Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Pre-anesthetic medication which is used for all of the following. So pre-anesthetic medication is used to decrease the secretions, to produce amnesia and to allay anxiety, and this pre-anesthetic medication will not reduce the dose of inducing agents. It is only used for decreasing secretions, producing amnesia and decreasing anxiety, not for decreasing the dose of induction agents. Antiemetic prophylaxis is given for. Antiemetic prophylaxis is given for patients routinely. We do not give, it is not given routinely. It is given for all pregnant patients, and it is given for those patients who are operated for middle ear surgery, and it is given if there is any history of nausea and vomiting in the pre-operative period, then we give an antiemetic prophylaxis. It is not given on routine usage. Drugs used for pre-medication. Drugs used for pre-medication are diazepam, pethidine, and atropine are the drugs used for pre-medication. Fourth question. Atropine will decrease the salivation, and it also causes bronchodilation. These properties are used in, because of these decreasing salivation and bronchodilation, atropine is used as a pre-anesthetic medication. Question 5. Pre-anesthetic diazepam is administered in which way? Pre-anesthetic diazepam, is it administered orally or IM, IV or subcutaneously? It is administered orally. Pre-anesthetic diazepam is administered orally. Pre-anesthetic medication, which of the following is a pre-anesthetic medication which is causing longest amnesia? Pre-anesthetic medication causing longest amnesia is lorazepam. Lorazepam is the pre-anesthetic medication which is causing longest amnesia. Amnesia produced by benzodiazepines is which type? Is it anterograde or retrograde? Amnesia produced by benzodiazepines is anterograde amnesia. What is the action of atropine? Atropine decreases the secretions. It causes tachycardia, that is increases heart rate, and it causes mydriasis.
thank you and thank you for watching.